Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. A study published in the journal Alzheimer's and Dementia in March of 2022 has shown that unhealthy blood cholesterol levels and unhealthy blood glucose levels in early and mid-adulthood are associated with a higher risk of developing Alzheimer's disease later in life. So the study was an extension of the famous Framingham heart study, following about 5,000 individuals, they've been studying participants in the Framingham heart study for many years and decades. Now, this arm of the study showed that a 15 milligram per deciliter increase in the good cholesterol, the HDL, measured during early and middle adulthood was associated with a decreased risk of developing Alzheimer's disease later in life. So if your HDL is in a good range at most of adult life, your risk of developing Alzheimer's is less as you get older. As well, a 15 milligram per deciliter increase in your blood glucose level or your blood sugar level during middle adulthood was associated with almost a 15% increase of Alzheimer's disease as you got older in later life. So keeping that blood sugar down and getting your HDL up are great targets. The study also factored in the person's age, sex, blood pressure, body mass index, smoking history, and educational status. The researchers concluded the following, and I quote, "Our findings suggest that careful management of cholesterol and glucose beginning in early adulthood can lower Alzheimer's disease risk." In their opening comments, they state that Alzheimer's disease is the fifth leading cause of death among Americans 65 years of age and older. To date, there are no proven effective disease-modifying therapies to prevent or slow cognitive decline from Alzheimer's disease. Early identification and treatment of individuals at risk for the common form of Alzheimer's disease occurring after age 65 have been recognized as an important contributor to reductions in Alzheimer's disease mortality and delaying the symptoms of the disease. That means if you can manage the risk factors, your risk is going to be lower. So in this study, we learned that keeping your glucose and your HDL levels in the desirable range are two important ways to reduce risk of Alzheimer's disease as you age. So really good targets to shoot for throughout all of adult life would include these. A fasting glucose level, a fasting blood sugar level that's under 90 milligrams per deciliter or under 5 millimoles per liter. A fasting HDL level, that's the good cholesterol, above 60 milligrams per deciliter or above 1.6 millimoles per liter. Some other risk factors or some other lifestyle factors that are shown to help reduce the risk of Alzheimer's disease include the following. Keep your total blood cholesterol in the ideal range. Participate in regular aerobic exercise. Achieve and maintain an ideal body weight as best you can. Get adequate intake of omega-3 fats, and that usually requires getting supplements of omega-3 fats in this day and age because you can't eat that much fish because of the mercury risk. Avoid or limit alcohol intake. Keep your brain active, learning new things or new skills on an ongoing basis. Avoid head injuries. Keep your blood pressure in the ideal range. Drink green tea almost every day or every day if possible. Maintain an optimal blood level of vitamin D. That means above 75 nanomoles per liter or above 30 nanograms per milliliter. And after the age of 40 or 45, consider taking a supplement that contains melatonin 1 hour before bedtime. And after age 55, I suggest taking a supplement that contains these memory support nutrients that the brain really requires as you get older. That would include a combination of CDP choline, huperzine A, bacopa monnieri, and phosphatidylserine to help maintain brain levels of the memory chemical acetylcholine. According to published studies, preventing Alzheimer's disease to the greatest degree possible involves paying attention to a number of dietary lifestyle factors throughout all of adult life, as I've outlined here. Some people just play crossword puzzles, or they use their brain for different types of problem solving. But you need biochemical support as well from nutrition, and you need exercise. You have to avoid head injuries. There's all kinds of protective nutrients in foods and other supplements. Bringing all these things together into a lifestyle program, that really is the best solution to trying to reduce risk. So the good news is that these factors are largely under your control, and so you should feel empowered knowing that your personal wellness choices from day to day can have a significant impact on lowering your risk as the years tick away. So I've included the reference for the 2022 study in the text below, as well as the references that support the other Alzheimer's prevention strategies I mentioned in this video update. So thanks for watching, and I'll see you next time.